Joining us now is the former head of Medicare and Medicaid and the Affordable Care Act under former President Obama, Andy Slavitt. Andy, good to see you. What do you make of this? This is the plan, Medicare for All, with a way of paying for it, according to Elizabeth Warren. Have you had a chance to look at it and get a sense of the price tag minus the savings, equaling a net cost of $20.5 trillion?
I have. And thanks for having me on. Look, I think the Democrats have two types of main plans out there now. There's a plan from Sanders and Warren, which is a Medicare for All plan, and then there are a set of plans from people like Biden and Amy Klobuchar and Mayor Pete Buttigieg. Importantly, as far as the American public defines it, all of them do the same thing. All of them promise to cover every single American for their health care coverage. And now the big differences between the Warren plan and, say, the Klobuchar type plan are that in the bigger plan, there's only one choice. It's Medicare. It's administratively simpler, but it asks 150 million Americans who are getting employed benefits to come off of that plan. The other choice is considerably less expensive. Also, those plans are paid for, not considered as bold, and still keeps insurance companies around, which isn't all that popular. So, not a big surprise that Senator Warren came out with a plan today that with some details. But what I think is important, Allie, is that because each of these plans cover everybody, Democrats ought to be probably spending about 10% of their time talking about those differences. They should probably start to spend 90% of their time talking about the contrast with President Trump, who's still trying to derail the entire ACA through the court system and is trying to get rid of health care coverage, period. And that contrast, I think, is an important one for all of them to try to draw.
Well, they're not making it yet. And for at least the next short while, they're going to be poking holes in her plan, specifically her plan and her plan to pay for it. You think it works?
Well, look, these numbers are big numbers. She's foot every single one of them. There's a lot to look at. There's a lot that are taxes for the wealthy. That are some that are based on some efficiencies. But when you get to numbers that big, you're dealing with very, very big assumptions. If you take, by contrast, say, Senator Klobuchar's plan, which allows everybody to buy into the Medicare program who wants one, she accomplishes that by essentially bringing back the Obama-era tax rates, essentially undoing the current Trump tax cut, and by negotiating prescription drug prices. So it's a lot simpler. It's a lot simpler to understand, and people keep their coverage. So I think it's a matter of whether or not you think we need to go very bold and very big, in which case you're going to have a lot of assumptions and a lot more taxes on the wealthy and a lot more changes and a lot more to implement, or whether or not you think you can get to the same place as Klobuchar and Biden are trying to get.
Across the board, every American wants to have health care. But in the last few months, we're hearing, and it's those who are on the other side, not Elizabeth Warren, saying people don't want to get rid of their health care. They might not love it, but they don't want to tear up the script and start over. Who is the majority that Elizabeth Warren or Bernie Sanders are speaking for, who are saying, let's wipe out what we have and start anew with Medicare for All? Who is that?
That's a great question, because it depends on what question you ask and what you listen for. What Americans want is they want to know something very simple, that if they have to take their kid to the doctor, or God forbid their spouse has cancer, that they're going to be able to afford to pay for it. That's it. And if you ask them whether or not the government has a role to play or an insurance company has a role to play, that's less important to them. They just really want the system to work, and they don't want anybody to be able to take it away from them. So in some respects, as far as the public's concerned, this is a little bit of an argument over what they prefer, sky blue or powder blue. Right now you have a president who is contrasting with a gray sky, and they are both arguing for two different ways to make it happen so that Americans can get what they want. And I think that contrast isn't as important to the American public as perhaps some of the candidates may make it at a time.
Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.